Hello, my name is Dr. Charles Weaver. I am the founder and publisher of the RA Connection. I want to thank you for joining us today for a web chat with Marie Berry on how to be an empowered patient with rheumatoid arthritis and other chronic conditions. Diagnosed with rheumatoid arthritis, systemic lupus, and Sjogren's syndrome 16 years ago, Marie is focused on helping fellow patients receive the very best information about how to live a full and productive life while managing a chronic disease. I will now turn the presentation over to Marie Berry. Thank you.
Hello, I'm Marie Berry, and I'm really delighted to have been asked today to share my story as a patient living with 3 autoimmune diseases. I want to tell you how I was diagnosed, what led up to that diagnosis, what I did after finding out that I was going to have to live with 3 pretty serious autoimmune diseases that were not going to go away anytime soon, how I handled the first few years, and how things have worked out in the last years of living, a person living with rheumatoid arthritis, which is the disease that is most prevalent in my case. So let's go back in time, 16 years. At that time, I was head of business development, international business development actually, for a pharmaceutical company in Palo Alto. And I was overseas, which was the totally normal place for me to be, when I started getting pretty darn sick. And I don't mean just garden variety sick. I'd been on the road for 2 weeks, also perfectly normal for me, and I just hit a wall in the most big time way. I ran down, I was swollen, I was hot and feverish. The big thing that really got my attention and made me call home from Spain to my husband was that I could not think in a straight line. My brain literally felt like it was melting down. I got home, and of course, the next day, I went to my doctor to find medical help or answers to questions. These were issues I had never had before. I went through a battery of different specialists, and over the next 4 to 6 weeks, what I had been treated for, which was repetitive stress, really had nothing to do with what was wrong with me. After a number of blood tests, I was shown to the office of a rheumatologist and told that I had rheumatoid arthritis. I was pretty shocked. I had never had a history of any kind of arthritis at all, much less the kind that had big implications for other organ involvement or was a chronic lifelong disease. I was so sick, all I could do at that point was stay in bed. He also diagnosed me with vasculitis, which explained why I was so swollen and hot and experiencing pulsing pain in all of my extremities. I went on high steroid doses to quell the inflammation, and that helped a lot, but it brought its own problems. I couldn't sleep, I was having incredible mood swings, and I know that any of you had to take prednisone or Diapaxil steroids have had the same experience. So we've all been there. And for as much as we need the steroids, I also call it my devil drugs. Anyway, this gentleman got me through a pretty big crisis. And while I was home, sort of just trying to regroup my strength, I started to read everything I could get my hands on from colleagues in the industry, to talking to people who were in immunology, to journal articles, and then to pretty good, reliable resources online. I like the Mayo Clinic website and the Cleveland Clinic, and of course the Arthritis Foundation. This was 16 years ago, so there was nothing really like what there is today in terms of patient information. But I was lucky to be in a good spot, and I talked through with colleagues and decided that what was going to be really important for me was to treat my condition very aggressively. When I got back to a face-to-face meeting with my doctor and shared my thoughts with him, I was really surprised to learn that his view in terms of making a treatment plan together was going to take it in a very conservative way. He wanted to start me on tried and true drugs that had been around for a pretty long time and move me through them slowly so I would trial and fail, which is a pretty common way to go with a patient who's newly diagnosed. I went home and thought about this very carefully, but I was troubled. And I knew in my heart that I felt I would miss a big window of opportunity if I didn't try and treat with the full kind of quiver of things that I could use. I really wanted to know I was going to be walking in 5 or 10 years. I made an appointment. I went back. I thanked him profusely for diagnosing me, but I told him we were going to have to separate paths. And I told him how grateful I was, but I needed to go and move on. And I share this story because it was my first chapter in being a patient advocate. And oddly enough, I was advocating for myself. It was really important in the history of my time as a patient with autoimmune diseases. My next doctor was really in the boat with me about treating me aggressively. And I embraced all of those serious big drugs, as I call them, and the side effects I knew they would bring because I was working my plan and it was important to me. I want to look at the first few years I was diagnosed as opposed to the next 10. I call those years being caught in the whitewater, and I will tell you from my heart, I was a mess. It was a terrible time. I was in extreme pain. I was having drug side effects, which I knew I was going to have, and I embraced. But, you know, everyone sort of focuses on the physical aspects when you have big, serious, lifelong diseases. And what I'd like to share is I hope you will also focus on the psychological aspects of sort of feeling out of control and feeling there's little you can do. And for me, a big thing was also realizing that a chronic disease means it's never going to go away. This was really a hard thing for me to wrap my head around. And so what I'm advocating here for you is that you and your physicians and your family and your support structure also concentrate on the emotional side of being well as getting well on the physical side. That's just something that when I talk to patients comes up often. Being caught in the whitewater was no fun at all. I was a person who was used to being in control of my life and my destiny, and I realized in very short order there was no control. I needed to figure out a way to feel that I was managing my life instead of my RA managing me. I realized that I had started tracking things, although initially I was using Post-it notes. I was generating a lot of data. I was seeing my rheumatologist on monthly intervals. And then other things started happening. My asthma started to kick up. I had tummy problems. I had all kinds of other issues. I had to see an ophthalmologist often because of the drugs I was taking for lupus. So all of a sudden, I had this full-time job that was involved in seeing physicians, tracking my drugs, which were many. I was probably up to taking a dozen drugs a day or so, and trying to track lab results. I graduated from Post-it notes to Excel spreadsheets, and that helped because what I realized I started to do was make progress reports. I would track my drugs and the changes in dose, and then track the symptoms I was having against my lab tests. And I tried to overlay them one over another. My real big aha moment came when I realized I could use business and management skills, which is my comfort zone, in managing my disease. And this happened maybe 3 years out. Sometimes I'm a slow learner, but I use the things that I used every day at work, making a business plan, tracking to plan, running a meeting, and sort of took that whole skill set and moved it over to taking care of myself. So my new business was taking care of me. My goal was to stay as well as I possibly could. My strategy was to take a small agenda to every business meeting, my doctor's appointments, and see how things went. If nothing else good happened, at least I felt better about how I was handling things. Well, lo and behold, I'm here to tell you it's worked really well for me. I go to every meeting really prepared, or rather every doctor's appointment. I bring a short list of 3 to 5 issues that I really need to have answered. My doctors respect the fact that I come prepared. And, I feel like I get more time with each one of them. My responsibility is to let each one of them know what the other one is doing with me. So I see myself as the general manager of me. It's worked out pretty well. I'm here to tell you that these past 10 years, and now it's 16 years managing 3 diseases, have been so much better than the first couple. I only wish I had had the ability to look forward in time and realize that things could possibly be better, because I felt terrible, not only dealing with the diseases, but feeling like I'd never have the upper hand in my life. And now at least using a skill set that I'm pretty comfortable with, I turned a corner. There's some other things that I'd like to talk about today that other patients I talk to ask about often. And they are, how does one live in pain? And pain seems to be a common thread that runs through every person living with a chronic autoimmune disease. Pain is the first thing I sense every morning when I open my eyes, and it's the last thing I deal with when I close my eyes at night. But it was a very personal decision for me not to take what I call big drugs for pain. And it goes back to just wanting to feel in control. Being in control for me means that my brain works, so I didn't want those side effects. I decided that just using Celebrex plus a lot of Tylenol works for me. But the tip I wanted to pass along is that I found that acupuncture and mindfulness meditation are also 2 things that really help with pain control. So if you haven't looked into those, you might want to give them a whirl and see if they work for you. It's a very personal decision. There are a lot of things I've learned over time in talking to other people who live with these chronic conditions. And I've always come away so much richer for the experience of listening. So in addition to talking about my own journey, I would love to hear from you at some point about how it is that you cope and what works for you. And going back to when I started my journey as a patient, there just weren't very great support groups. You might want to look in your community for something that might be run out of your doctor's office or a hospital nearby. I also will say that there are really great online support groups where if you're too far to find a support group in your community, support groups like RA Connect really can help you feel a part of people who are sharing your experience, which is so important. Not feeling alone is really the thing. My last thing, and I know it sounds sort of counterintuitive when you're trying to conserve your energy, is I found that taking the focus off having these diseases by being involved in my community as a volunteer when I have the energy to do that, feeling the love of family. My secret weapon in my own story has been my husband, who's been endlessly supportive, but also having a close group of friends and family are as good to me as the most powerful drugs. So I think that goes back to taking care of your mind and your soul as well as your body. And if you take care of your whole being, I think you come to a point in your heart where you feel much better than you possibly thought could ever be. I hope to hear from you after this broadcast is over, because as much as it's been a privilege talking to you today, I would hope that you would feel comfortable enough to share your story with the RA community. We all are here to learn from one another, and I think it's absolutely makes no sense at all that people who are diagnosed after me or after you should have to find out all the things that we know from being a patient um, from scratch when we can help them. And also, I'd like you to leave you with the thought that if you take all the little tips I've shared with you today, in my case, using a business skill set to help you manage your disease from day to day, you really come into a time where you become a practiced patient. And I think that's so important. And like any other skill in life, whether it's a backhand for a great tennis game, or running, or exercising in a certain way, or another kind of skill, the more you practice, the better you are. And the payoff in this particular thing is enormous. It's your good health. I'd like you to leave you with that thought. Practice really does make perfect. And the payoff is really huge. Be as well as you can be. I really hope to hear from you. It's been an enormous privilege to talk to you today. Bye-bye. Be well.